Hi, I'm Sarah Ozel-Shore. The Clinical Discernment Framework begins from a premise that I think most experienced clinicians will recognize, even if they haven't had the language for it. That what determines whether a session produces genuine psychological change is not primarily the quality of the intervention, but the accuracy of the clinician's read of what the moment can actually hold. That read involves a specific set of clinical capacities, 6 of them, that can be assessed in real time, session by session, and that together tell a clinician a great deal about what kind of work is available to this client right now. Not in general, not in theory, but in the specific conditions of this particular session. The first is regulation, whether the nervous system is sufficiently organized to support the kind of work being invited. The second is relational contact, whether the client is genuinely present with the therapist as a real other, rather than going through the motions of engagement. The third capacity concerns whether dependence and agency can coexist safely in the room. The fourth addresses access to aggression as a constructive psychological force. The fifth capacity is the capacity for symbolic and reflective thought, what the research literature calls mentalization. And the sixth is integration, whether psychological work can be carried across the distance between sessions and really used in the client's life. That's integration. Each of these capacities has observable indicators. Each can be learned to be read by you as the clinician. And each fundamentally changes the clinical decisions that you make when it is accurately assessed rather than assumed. The September 17th training I'm offering is a full day focused on developing exactly that. Not a new clinical modality or technique, but the skill of structural assessment that makes any modality more effective, that makes every session more effective. And if that is work you want to be doing, I hope you'll register.